here we go.
Okay, why don't we call ourselves to order at 3:02 on Monday, June 13th. I'm looking forward to a motion to approve the minutes of May 9th, please.
So moved, Mr. Chairman, Mike Norton.
Thank you. I'm looking for a second.
I'll second it.
Thanks, Harold. Any discussion or comments on the meeting minutes from last month? Jan, I think you might be muted. Okay. All right.
Paul,
Yeah.
this is Rob Patterson.
Yep.
I have a question. I don't know what the acronym ARPA is.
I think it's called, and Beth, check me on this, American Rescue Plan Act, I think is
Yes.
the,
Okay,
ARPA, yeah.
Correct.
okay.
okay. Any other comments or questions? Otherwise, let's consider the meeting minutes approved as written by Beth. Okay, Beth has got an extensive conversation about the budget process going forward. So with that, Beth, take it away.
All right. So sometimes people ask questions about the budget and, for example, how the ADRC funding and budget fits into the greater picture. So I just wanted to do a summary of how that all works. The state gives us a grant to operate our ADRC, and it's largely used for the staffing purposes, but we also have money that we use for advertising and promotions and things like that. That grant is part of the long-term support program budget. So within long-term support, we have our ADRC, Adult Protective Services, Benefit Specialists, and our Children's Long-Term Support Programs. All of that, all of those revenues and expenditures are part of long-term support, which then fits into the Department of Human Services budget. Some ADRCs are a separate standalone entity, but in Winnebago County, we are part of Human Services. So the ADRC money rolls up into the long-term support, which rolls up into the Department of Human Services budget, which then, of course, goes into the entire county budget. The way that process works is we are just now completing the budget for 2023. I know it seems early, but it's got to be done now. And then at the end of the month, there are public hearings, or a public hearing, and the Human Services Board votes on the budget. The public hearing and voting is it starts at 8:30 on June 29th. And that will be, I believe, done at the airport, as well as I think there's a Zoom option for that. But that's when the public hearing is. And then after the comments that are received or letters are read that were received, the Human Services Board votes on the budget. After they vote on it, the county exec, it's kind of his budget, so he gets to take a look at it, of course, and make any changes he sees necessary. And then he presents it to the Human Services Board in October. And the county board. So the county board, which is like the whole county board of supervisors, then votes on the entire county's budget, which of course includes our human services part, in October. And then before it's finalized, the county exec has one more opportunity to change, veto, add, subtract things as he sees fit, and then it's adopted. So that's how our budget works. Because we also serve as, I'm going to complicate this a little bit more, because we also serve as the aging committee, our aging funds are predominantly Older Americans Act. And there's several different components that help us address our meal programs for older adults and people who have low income and disabilities and whatnot, our specialized transportation funds that we get from the state and federal government. We have 2 different pots of caregiver support programs. And we have some specific adult protective services funds that comes from the state. So just to mimic the process that I explained for the ADRC, all of those different funding sources go in to serve those types of services, that they're part of the long-term support budget as well. And then they go on up from the long-term support into human services to be voted on at the end of this month, looked at by the county exec, voted on by the county Board of Supervisors in October, looked at one more time, and then approved.
Can
That
you
makes
clarify?
sense to everybody?
I have one question for clarification. June 29th at 8:30 PM? or
I'm sorry,
8:30?
8:30 a.m. We usually
Okay.
have, a good question. We usually have an evening session and a morning session. This year,
Okay.
there's only going to be one public hearing, and it starts at 8:30 a.m. on June 29th.
All right, thank you.
One thing though, Beth, the public hearing on the 29th is set up only from 8:30 to 9:30 for the
Yeah,
public hearing part.
Correct. I mean, if there's still people talking at 9:30, I think that they continue to take people, but typically we don't get that many comments. But you're right, it's scheduled from 8:30 to 9:30.
Beth, is there an option to submit written comments?
Yes, there is.
You probably mentioned that. I apologize. I
Nope.
was just looking.
No,
I've got meetings that morning, so.
yeah, there's a lot of people who cannot attend, and you can email or write comments. Harold, do you know, or Mike, do you know specifically who they send them to?
Could we just send them to Mike maybe, and then he can?
No, I'm
No?
not on the human service board anymore, one thing.
Oh, that's right. Oh, so it's human service.
I
Okay,
would-
got it.
I
All
would
right.
say, I would say to send it to Pam from
Yeah,
the
Pam
administrative-
Barca, yeah.
because, or the
Okay.
county clerk, either the county clerk or Pam, because they'll get
Oh,
it to the
okay.
committee members. That's
I
the
will
two.
email all of you Pam's contact
Great.
information yet today. Thank you.
Thank
I
you.
wasn't sure if it went to Bill or Pam, but I'll send you Pam's information then today.
Okay.
Thank you.
As far as any changes, the only changes that, I guess to highlight the changes for next year, we're adding a position that's going to be half adult protective services and half ADRC. And that's just given the number of referrals. We need more on-call ability to handle the number of referrals. We have numbers to show that our time that we take with customers is taking longer per customer. So that position will be added in 2023. And we do have to do some cuts in some of our senior programs. Looking at, we had to come in with a 0% increase minus 1.5 million. So we have to take levy out of our budget. And that comes out throughout the entire human services department. Everyone looks at their programs to see where can we make reasonable cuts. For long-term support, some of them have to do with the fact that we put a lot of extra levy into our meals, transportation, and senior programs. And so we will be looking at potentially cutting the funding that we provide to Route 10, which is a bus route from Oshkosh to Neenah. We are looking at potentially cutting, doing some changes to our meal program. We have yet to meet with AdvoCap and kind of hammer that out, how that'll look. We have a senior friends program through AdvoCap that we're not using anymore. So just kind of looking at some programs that maybe don't have the same purpose or effectiveness that they did when they were developed, and making some changes in that way.
Are there any opportunities for using American Rescue Plan dollars as a temporary backfill on some of these proposed changes?
Were you part of my call this morning?
I'm just asking.
We did discuss that this morning, that there's going to be a request to see if we can use any of those funds to do a pilot program regarding transportation.
Another question I have, as someone who's managed budgets a good amount of my career, would be with inflation currently, both, across the country and certainly here in Oshkosh and Winnebago County. If I'm an agency right now like AdvoCap and the meal program, or either the meal program or drivers who deliver the meals, what kinds of opportunities do they have to recover some of their additional costs?
Just like other entities and businesses, a lot of the companies that we work with and agencies we work with were able to request funding. So for example, AdvoCap, I believe, requested some funds to get new freezers because they needed more freezer space. So they had those same opportunities. You know, rather looking at more funding, I think one of the takes that we want to do right now is looking at efficiencies in how we do things. So right now, for example, our meal program operates 5 days a week, and the person delivers the meal, stops in, so on and so forth, and then they give frozen foods for the weekend. What would it look like if we did maybe 3 days a week? So someone had a visit every other day, still had the same amount of meals. You'd get 2 meals, you know, one would be hot, one would be for the next day. You know, so we don't want to cut nutrition by any means, but we all know that the cost of gas and food and stuff has gone up pretty high. And the funding sources have not gone up with those. So how can we serve people more efficiently?
Okay, thank you.
Harold, I have a question for you, since you're on the Human Service Board. What is the projected surplus this year for the Human Service budget, and what was the surplus for last year?
I don't remember the exact number for last year, but the last projection they had for this year is 4 million.
You know, and I'm very critical. I'm gonna be very critical because we fund positions that we're not filling, and that's how some of this surplus comes. And I think the surplus could backfill, or whatever you want to call it, these services and programs we're cutting. So I'm going to encourage you people to make your say known to the Human Service Board members and everyone, because I'm sort of critical, and I've heard the projected $1.2 million cut, and I heard it's not a cut. Well, and then we give these projected surpluses every year. I don't see why we have to do it per se. So I'm not on the Human Service Board. So when it comes to the county board, I'm going to be very critical of many cuts in this particular program or this budget. I'm going to say it. So that's my say. I'm sorry.
Yeah, and so really just to kind of reiterate what Mike just said, you do have 2 opportunities to have a voice in the budget process. One of them is on or before the 29th of June for the Human Services Board. And then once that gets passed on through the county exec, when the county board goes to vote in October, that is another opportunity for you to contact your county board supervisor if you have things that you feel strongly about regarding the budget. So there are 2 opportunities. The other thing that I want to explain for those of you who aren't as familiar, when we talk about the Human Services Department giving funds back or having a surplus, the reason why that's happened for a number of years now is because the way the state reimburses us is we've got some definite grant funds and program funds that we know we're getting. We've got some that we know we're getting, but we kind of guess at the amount. And then we've got these additional funds that the state reimburses us, and sometimes it's for 3 years previous. So for example, at the end of 2021, we received a chunk of money that was from services and things that we did in 2019 and 2020. And the state can never tell us what it's going to be. Our auditors won't allow us to actually put that in the budget to say, well, we know we're going to get something, let's put a certain dollar amount in it. Our auditors won't let us put it in the budget to use it. And it really puts us in a predicament. Some of this surplus is also due to unspent labor with the hiring difficulties. There's often unspent labor costs when there's a position that vacant position. And that's something that we're trying to get much, much better about, putting a certain percentage of our labor and decreasing it, knowing we're not going to spend our entire, like that we're not going to be fully staffed 365 days next year. So we don't even budget for that anymore. So we're trying to get better at accounting for that. But there is a chunk of money that comes to the Human Services Department, predominantly through economic support and behavioral health that we can never anticipate and we can never count on.
I have one other question if no one else has a comment. I would hope going forward, Beth, that the Human Services Board and you and Bill and others really think about, if we're going to go after agencies and shrink their operations, that it be done with a lot of equity and a lot of fairness. And, it doesn't have, they're viable for 23, but come 24 or 25, that whole operation is kaput because it can't be sustainable. And we have enough challenges with the, particularly this recent housing study that we finished. We actually need more services, not less, in many areas. And it's concerning to hear. I certainly sympathetic. I've been through this process many times, but hopefully I know I'm preaching to the choir here, but thank you.
Certainly. And one of the other things that I think we're going to be talking about our committee's priorities. That was something Harold brought up at the end of one of our last meetings, and it's going to be on an upcoming agenda to start thinking about what our priorities are. And I know that I'm going to have a very strong voice about starting to look at doing a more coordinated effort to look at the community supporting the community. So we've got some free respite programs that some churches operate. How can we do a better job with rideshare programs? We don't have hardly anyone riding Route 10, but we know that there are some people going from Oshkosh to Neenah and vice versa. We don't do a very good job of ride sharing. How do we support each other as a community? I think that there are some things that we can learn from other communities, and we're very creative and giving community that we can probably come up with some ways to help formalize some ways to support each other in an equitable way.
Yeah, thank you. Any other questions of Beth on this topic of budget update?
Well, I would like to kind of add on to some stuff that Paul was saying. There are two types of programs. The one type are the mandated ones by the state. They're saying we have to have them. And then there are the other programs that we're not really forced to have them. It's my understanding that when push comes to shove, money-wise, the mandated programs will still operate. Either the state will give us the money to run them, or if they don't and they tell us it's county, you're gonna run them anyway, but we're not gonna give you the money. Well, then the county will have to come up with the money. That was my understanding.
I think it used to be that way, Harold, but with there are some programs that are mandated that the state used to fund, and as the program costs have gone up, the state hasn't kind of ponied up to meet that. So some examples would be adult protective services. We haven't had an increase in adult protective services funding in decades, and literally, and yet it's a statutory service. We have to provide it, and we don't get, that's not a fully funded program. Birth to 3 is another required program. It's an entitlement program, and the counties put in more than the state does.
Yeah.
So you're right, and you're absolutely, and you know a lot about budgeting too, that there's the required mandatory services that we have to continue to do. So when we look at our levy dollars, they have to go to support those programs.
Yeah.
And then it's the other non-mandatory programs that we have some discretion over.
Yeah.
Any other comments? Okay. For now, we'll move on to something else. One of my favorite topics, specialized transportation. Nicole or Beth, you'd like to start us off?
There was some talk about possibly having the Specialized Transportation Committee and this committee merge into one committee. And Nicole, let you take it over as far as where that went.
Sure. So I brought it up at our last specialized transportation meeting. They had said that they're happy to come to this meeting and provide an update if that's needed, but they would prefer to remain their own meeting to stay very solely focused on specialized transportation. More so because everybody on that committee said that they have really busy schedules and don't have a lot of time to commit to other things. And so they just really only want to focus on the transportation and maintain that committee as such.
So they will,
I have a question, Beth. Who determines whether or not we keep that committee or have that committee merge into this committee or the Human Services Board? I mean, that's my question because I brought it up.
right now, it's just up to the committees. There's no requirement to do it. There's no mandate. There's no one saying that we have to do that. So we're leaving it up to the committees.
But okay, you didn't really answer my question. So if I wanted to make a motion to have their duties merge with us, I could do that without their approval. Is that what you're saying or not what you're saying?
That committee would have to vote on becoming part of our committee because they are a separate standalone right now.
I'm gonna challenge that, Beth, and we can put it on another month. That committee doesn't have any established guidelines of who their members are. I could be on that committee, anyone can be on that committee. And that's one reason I think it should be merged into an established committee where you have members who have to be assigned or appointed by someone. I've gone to those meetings for years, Beth, and other than one or two meetings or one meeting in the fall, I don't see much happening. They get around, they talk, nothing's happened. I don't see specialized transportation advancing in this county by having that special committee. That is why I'm bringing it up now. And that's why I think that what they do every fall, I think they have to give out the grant money where that could be done by the Human Service Board or this board. And that's why I'm going to say, I think the jurisdiction of whether or not it's established is by a committee that does have some jurisdiction. And I'm going to say it's not us, Human Service Board. Because they're going to say no. I heard them. I was at the last meeting. I heard. I do not see the necessity of having that committee. If they want to get together, whatever, every once in a while, fine. But to be an official committee, I don't see it. I'm sorry.
Nicole and I'll do some research and get back to you.
Okay.
I have something to say about that too. I like Mike's idea. I remember when the ADRC committee first started, people would come home, or the kids would come home, and they would see their parents, And what this gets to is somebody came up with a phrase, know us before you need us. And I think that if people were aware, more people were aware of the transportation options, then they would have more push to it. So that's my 2 cents.
Okay, we'll do some more research. And, the Specialized Transportation Committee was in existence prior to the ADRC committee.
Well, that doesn't matter to me.
I only say that because I don't think we have any authority to bring them in.
Oh.
But again, Nicole and I can look into it.
Well, and Rob, one of the things that we're doing in our age-friendly Oshkosh or livable communities through the AARP is we are having a separate focus group on transportation, outreach regarding transportation to get the word out there regarding all the transportation options that we have. And I'd love to have you in on that group. We are meeting once a month, and it's a group of different stakeholders in the community just to try to find different creative ways to engage people in the community and learning more about transportation and the options that we do have. So I can definitely let you know when we schedule the next meeting for that, because I think you'd be really valuable on that.
Okay. Thank you.
Good point.
And that is a group that's very focused on making change.
Any other questions or comments on this particular topic? Okay, Route 10.
Well, as I just alluded to, Route 10 has its history also. It was developed for many reasons, and in part to help people living in the Neenah or Menasha area to get to UW Oshkosh. So it was a ride that was funded by the city of Oshkosh, Winnebago County Human Services, UW Oshkosh, and some other funding sources. Because ridership has dwindled to very, very, very few people, UW Oshkosh has pulled out all of their funding entirely. Right now, it's just the city and the county funding it. And literally the cost it's just not reasonable at all to continue to run that route. So the city hired a consultant to do a study that's taking place right now on what are some other viable options. What do we do with Route 10? Do we change it? Do we make it more point A to point B? Do we combine it with some rural transportation? So that study is being done now. And the third bullet under here is the June 15th public hearing. There is a public hearing on this at the City Hall in Oshkosh this Wednesday, and it starts at 4:10. It is live only. You can only appear in person, so you can't Zoom in or anything like that. But if you wanted to voice your opinion on Route 10 or alternatives, you could go to that meeting on Wednesday at 4:10 at the City Hall on the 4th floor.
Do they have any proposed alternative?
They do. I can give you a sneak peek here. Now they're going to be presenting this, so I don't want to get into great detail, but I do have some information.
Beth, is that the same presentation we heard, like there was like a week and a half ago or something that, okay.
Yeah, it's similar to that, that the input that was received at the meeting from a week and a half ago was incorporated into this. So there's the option of keeping Route 10 as is, no changes. There is a way to look at it as more of a fixed, modifying it to be more of a fixed route service. There is the option of having it more seasonal. So it would run one course during the school year and one when it's not during the school year. There's another option of contracting out. There's a couple different companies. One's called VIA, who basically you contract out and they arrange everything, and it's the most costly option of all, but that is an option. Some communities have looked at utilizing like Uber and Lyft in different ways. Definitely some pros and cons of that. Safety is one of them, the concerns with that, and that will be presented on Wednesday. Cab connection service, which is kind of like basically it's a cab that will get you from one transfer center to the other. I think it's Green Bay that has something like that. And then, as I said, expansion of our some of our rural transportation and expanding that through like our Go Transit providers. So those are the options that are going to be presented.
Okay, any other questions or comments? My favorite topic, caregiver survey results.
All right, well, we have the results. The results are in. Let me pull that up.
You're gonna put it on screen or?
I'm gonna put it on the screen here. And I
Okay.
didn't have it right up because I just switched over to my other information.
All right. You're competing with Lana.
She's better at this than I am, though. Okay. Can everyone see it?
Not yet.
Nope.
No? Okay. Well, now can you see it?
No.
Oh, all right. So it's loading. So there you go.
There it
There you
is.
go.
Sweet.
Okay, excellent. Sorry for the delay. So let's see here. We'll get over to the information. And actually, this is, I'm gonna postpone this one and switch over to a different format and bring this one back up. So here's the summary. I'll start with that. I won't read it to you word for word, but as you can see, there certainly is not adequate staff for the most part in agencies. We only had 13 agencies respond, but I think it's a pretty good, in terms of the types of agencies, it's a pretty good representation. I think one of the key things under the staffing is that the question about, are people hiring refugees? Only one of those 13 are hiring refugees. Wages are still pretty low. You know, when you look at other types of jobs, these wages used to be, you know, pretty equal to some other jobs that might be, you know, this kind of caliber, and really they're low. We're finding that agencies are having to go higher and higher with wages. So these wages that we found, I was surprised at. I think that they're low compared to what some of the needs are. Under the clients point, you can see that agencies are definitely turning away clients. So one of the things that this committee has talked about is the fact that people aren't able to get enough service. And as you can see, 10.5 clients per month are getting turned down from getting services simply due to staffing shortages. So this is the summary of what was obtained over the last month and a half.
So a good question for you. 10.5 is a cumulative number across all the 13 or so agencies that you surveyed, or is that?
No, that is per agency.
Oh my goodness.
Mm-hmm.
Oh, wow.
It's a lot.
So effectively, that means that
130 a month, at least.
yeah, and
Do
wow.
maybe, I don't know if this is appropriate, Beth, do any of these agencies provide their own training for new people?
Most of them do.
Okay.
Beth, are these agencies all focused on elder care? I don't recognize any of these for example, developmental disabilities or,
Yeah,
you know, like,
Exceptional Minds serves people with developmental disabilities. Bright Star serves people with developmental disabilities.
oh, okay.
Covey
Like
serves
in the
people.
home, like
Yeah.
in home care and all that kind of stuff?
Mhm.
Oh,
In-
okay.
Covey does out of home care. So yeah, we did get some representation from those types of agencies.
Okay, thank you.
And you'll see in the column I, the one agency turns down 40 people per month, one turns down 20 plus per month. So that 10.5 was an average of how many people are turned down per month.
So do you have any way, Beth, of what their rated or licensed bed capacity under normal circumstances would be?
We didn't ask that question. We only,
Okay.
because a lot of them are not, like Lakeshore, and the first couple ones on here are
Right,
facilities that can serve a certain number of people.
right,
But
right.
most of them, they can serve as many people in the community as there's a need for and that they
Okay.
have staff for.
Okay,
What's shocking to me is the volume of patients that they're having to turn away.
yeah,
And it makes you wonder, I mean, where are these people going? If they were that bad in the first place that they needed nursing home care or some sort of care, I'm assuming they're in the home and somebody at home, you can add another in-home caregiver to the list or something. I don't know. That's really interesting.
Yeah, I don't remember.
Claire, I'll give you, oh, sorry.
ahead.
I'll give you an example from my life. In the last 3 weeks, I have taken 6 days of vacation just to take care of my son because his agency can't, I mean, they're doing everything they can. I just got them to say that they could cover 7:30 to 4:30, Monday through Thursday. So I was, for the first time in 3 years, I'll be able to do a full day's work. Or however, since the beginning of the pandemic, whatever it was, but I've been going to work from 9 in the morning until 3 in the afternoon because that's all I could get coverage for. That's with a child with a disability, but it's similar. And that's exactly what's happening. But I arranged it so I can be home on Fridays, so I won't have any care on Fridays. And then today I'm on vacation because as you saw, my son was walking. They didn't have anybody today. So just an example. I'm just using my own situation as an example.
It reflects pretty much the same things that I went through also. Thankfully, though, when I was working, they had a really decent family leave program, and it was discontinued just a week or so before my mom passed away. So I just shuddered to think what happens when, I mean, it's a lot.
Yeah. So I think these numbers reinforce what we've talked about. I mean, you know, concerns we've had. I don't recall who wanted us to add that question of turning down customers and clients, but it certainly is definitely the case that the agencies are having to do that.
I did request that, Beth, just because it kind of worried me, and I'm now, I didn't expect the numbers to be that high though, but thank you.
And so again, this is 13 agencies. There's probably 100 agencies in this region, so it's a lot of people.
is the state of Wisconsin, your counterparts in Madison, doing anything in terms of upcoming budget proposal development?
I'm not aware of anything that's being proposed for the upcoming biennium budget. I know that there was an 5% increase last year, I believe, the beginning of last year. Beginning of 2021, there was a 5% wage increase, and that had to go directly to staff. It wasn't something agencies could put into their own budget. That helped a little bit. There's a lot of committees and people talking about stuff. You know, everyone recognized the work shortage along the lines of what I mentioned with doing more ride sharing and things like that. I think that there's more, people are developing more natural ways to support each other. For example, you know, this is just a hypothetical. If Liz was working 50% and she had a friend with a son with a disability who happened to get along with her son, who's working 50%, one of the two of them would take both kids 2.5 days a week, and the other one would, you know, so some shared responsibilities for things. You know, I think we can learn from other countries and other states. You know, what are people doing? Care.com has been something some people have tapped into again, limited, but had a little bit better success than your standard agencies because you have authority to pay what you feel is, appropriate versus what the agencies pay. You then are responsible for the training and many other, scheduling and all the other things. So there's pros and cons of that. But I think just trying to look at how we can do this a little differently is something we're going to be forced to have to do because there just isn't the sheer numbers in our state aren't there to support these programs.
What particularly troubles me is just, that out there's the caregiver stress that we've talked about at this meeting and burnout and all of that this is because of the agency deficits, it's all going to natural caregivers, whether that's spouses, grandkids. We hear stories now of one I can think of in particular is 2 daughters of a lady who happen to be teachers, and they can do this, but they have the summers off. So they are both coming back and spending their whole summers in our community because their mom can't find a caregiver to help her. So they're going to double team that shift, and one take half the day, the other take half the day to try to prop her up until adequate measures can be found. So we're hearing some kind of fairly, gut-wrenching stories already. And I just always go back to, it's particularly gotten worse with COVID, but y'all, we were talking about this caregiver crisis way before COVID even was thought of. And so this is not of recent onset, and it's only going to get worse. We have to kind of look at ways to make this type of work attractive to people because it's not right now. It's not at all. When I could go to Walmart or to Amazon or whatever and make $18, $19, $20 an hour or provide care to someone, which is difficult work, people are going to choose that other job.
Beth, did I understand you? You said we don't have the usage of the caregiver programs. The numbers aren't there.
Oh yeah, we're fully utilizing those programs. Absolutely.
Okay, I misunderstood.
Yes.
I thought,
No.
oh my God. Okay, all right.
We're maxed out.
Oh,
Beth,
I can believe that.
Beth,
Mike?
first, could you send me that report? And secondly, you said we have to reach out to other resources, other people. How about we reach out to the neighborhood groups and the churches and get them and see how they can help. And maybe within those groups, they have people who can maybe help that neighborhood person who's elderly or needs help. Maybe that's the way you have to reach out to them and bring them in. That's 2 groups I think we can maybe look into: neighborhood groups in the city and maybe other places, and any church groups. I mean, you hear church groups helping in many other ways, whether it's food drives. I don't know. Well, this is another way we reach out. Maybe they know people who be willing to volunteer or maybe get paid very low or whatever. Maybe that's what we have to help those people. I mean, help people like Liz. I mean, and what if you are a person of means and you're a mother or a parent or whatever, and you have to go to work, and who's going to watch your kids? And I think we have to find a way to help them and at least coordinate things to help them. That's what I think. There's a groups that we could maybe tap into.
Yeah, I know Liz has her hand up, but I do want to respond that there was some people through Goodwill Industries who were working with some of the neighborhood associations to try and do exactly what you're talking about. There's something called Share the Care, which is really kind of a more formalized effort to help your neighbor. And to my knowledge, it didn't go anywhere. Every time I tried to tap into them, and maybe after Liz is done, Brian could update too, but it didn't really go anywhere with neighborhoods really fulfilling those kind of roles. Could I mow your lawn once when your legs broke? Sure. But it just didn't ever take off the way we had hoped it would.
I only had my hand up. It sounded like you said, somebody said something about if you private hire, like if you're using, I guess, iLife funds, it made it sound like we can set the amount. I was given the impression that I couldn't go over a certain dollar amount, which is really low. And so did I misunderstand? I mean, if I'm staying
It
within my
depends on the
son's
funding
budget,
source. Yeah, it depends on the funding source. So managed care type of funds have a cap on them unless you can get an exception.
yeah, no, we're self-directed. So that's why I'll talk to, that's fine.
Yeah.
I haven't asked again because that was the impression I had, but I haven't been able to hire anybody. And so that's why I had hired my older son, but he's entitled to his life. He's been doing so much for us that we just can't. I'm sorry, you guys, you can't imagine how this has decimated my career. I mean, how many of you can go to your bosses as exec, I'm at what should be a supervisor level and say, I can only work 6 hours a day. And maybe once a week, I can't work at all. I mean, it's just, so I'm working weekends and this kind of thing, and which I don't mind doing, but I can't, you just can't do it. At some point, they're going to say, you know what, she's not reliable. We can't count on her. In fact, I know that's already happening. And you end up sending emails to your colleagues saying, I'm so sorry I didn't get back to you. And how many times do you say it's because of my family situation or whatever it is? And, you usually, as parents, you think there's going to be a time when you're going to be able to focus on your career, that your kids aren't going to be like 6-year-olds forever. And I'm sorry to share this with you. I know I'm preaching to the choir. You guys all understand this, but that's what happens. Now, having said that, I am so thankful I live in Winnebago County. I want you to know there is no way we would have had the great life we're having. We are having a great life. I'm having a tough time, but I just found out yesterday, or I guess today's Monday, this morning, that the agency can cover 4 days a week for me. And so that's really amazing. And I can work then from 8 in the morning until 4:30 in the afternoon, which is at least close to a full work day. So anyway, I'm sorry, you guys, I don't usually do that. I usually try to be sunshine because I really do. That is my approach. I mean, I really look at the glass, not only half full, but filling. It's just there are times when it
Liz,
gets.
you're fine. Okay, you're
You're
fine.
good.
You're
Thank
good.
you.
Okay.
Thanks.
You're
But
fine.
anyway,
You're
that's
good.
it. Thank
And
you.
I think to see the silver lining or the little bright side of the half full, your situation is incredibly unfortunate and saddens all of us. What we do see a number of is situations where that lack of employment because of caretaking responsibilities leads to a loss of job, loss of income leads to loss of mortgage rent money, leads to, and we've seen people head down an awful path. I could tell you a couple stories of situations that were just shocking and it was solely based on caregiver needs. That's it. That led a person to lose their job, to lose their apartment, to lose yeah.
And I'm not in danger of that. I'm certain that I was passed over for something recently. But every time I think of it, I think, well, maybe that's not the worst thing. You know what I mean? That maybe that's good. But yeah, no, you're right. I mean, I've got a friend who keeps calling me and says, any other ideas, because every agency has now said they won't take care of her son. And so I can't imagine. So I can imagine. Thank you.
Liz, can I just mention, are you on Iris?
Yes, I'm on Iris. So we are self-directed.
Okay, yep, I was on that also. And the funding that I got for my mom was up from Iris was about half what she had been getting through Winnebago County. It was nasty. I was very concerned. But anyway, the person who was helping me coordinate, your representative from Iris, she was so helpful. She said, Claire, you can fill out an appeal and just explain your situation. And I thought, really, I can do that? Yeah. And I did. And she was able to secure more money for me and more hours and everything. I think they just their initial approach is generically, well, here's the money and so on.
Sure.
But if you do appeal, it could be worth your time and effort.
Thank you, Claire. I do want to clarify, actually, we don't use all of Clayton's budget.
Gotcha.
So it's maybe a situation where we just need to move some stuff around or something like that, because the person who we have is tremendous. I think I was operating under a misunderstanding early on, but even beside that, it's just also these agencies aren't able to hire, and I do think that's ultimately where it goes. But Claire, thank you for that clarification. Especially, I think it's important for everybody to hear that. So
Yeah,
thank
and
you so much.
I think you can also appeal the rates that you're able to pay. I believe that that's appealable.
Oh, okay. That would be great. Well, I've got a meeting with her on Friday. So I want to make sure that no one thinks that she isn't doing a great job, because she really is tremendous. She doesn't know. The last time I met with her was before all this stuff happened. So I'll be talking to her on Friday. Thank you.
Any other questions on this topic of caregiver survey results? As always, a very enlightening and engaging conversation. So we want to talk about.
Last thing on the survey, not only send it to me, I think we should send it to state legislators. I think they need to know how big of a problem it is and see if they're going to do something. I'm getting on my bandwagon. I'm sorry, I'm late, but they can do something. They have to do more. This is a problem, really, and it's affecting people of all different economic strides. We just heard one. That's what I really, we can encourage that, please. I really want to encourage that. I'm sorry, Paul.
Yeah, I do think that not only numbers like that being shared with legislators, but also the types of stories, unfortunately, that Elizabeth just shared have an even greater impact. So the more people can share true stories, the more people tend to bend an ear. The other thing that kind of plays into this is that I did a survey on adult protective services, because the other fallout from this is we have adults who are in substitute care where they don't have staff. Now picture that. Your adult child is being tube fed or has significant need for supervision, and the agency tells you on Monday morning that they don't have staff as of Friday at 4 o'clock. So then it becomes an adult protective services issue. So we're seeing a very big rise in APS referrals due to caregiver shortages. And so we definitely have some advocacy organizations and some numbers and some stuff happening at the state level to help address it.
Thank you. Future meeting topics and the like. So Beth, do you want to talk about not getting together next month?
Yep. So I will not be here on July 11th, or I'm not anticipating being here. We can absolutely meet, and Paul can facilitate and be the chairperson as he always is. Or if you, just because it's somewhat near the holidays, if other people know that they're not necessarily going to be there or aren't sure, we can also cancel a meeting. We're not required to have to meet every month.
What is the wish of the committee? I have one vote for cancel.
You have 2 votes for cancel.
What would be on the agenda that couldn't be put up?
I don't think there's anything urgent other than.
For your vote, yes.
What was that, Rob?
This is Rob. I'm not, that day is all filled up for me. So.
Okay. Well, it sounds like.
I say cancel.
Sounds to me like general consensus is cancel, so be it. Now, Beth, are you going anyplace fun?
New York. Yep. Upstate New York.
Hey, why don't you take a foot? Yeah.
Yeah.
All right. So we're going to plan on canceling July then.
Thank
Okay.
you.
As far as the form of the meetings, I did mention about these needing to be recorded, and there are a couple of different buildings in the county where we can meet with a hybrid, where you can have people in person, and supposedly, I haven't yet seen it happen, but supposedly also allow Zoom capabilities where people calling in can see the people in the room. The people in the room can see the person calling in on the screen, and everyone can hear everyone. Again, I have yet to see it to believe it. I don't know if we want
Works.
to
That's
start
what they
pursuing
do,
that
like,
in
that's what
August,
they
or
do
whether we
training
want to give it a little bit more time to make sure that those options are,
I'm gonna say, Beth, we start right now. Alana's online. Alana set up the health boards, had one meeting, 2 meetings actually. Our last meeting was Zoomed and used a device called the Owl Pro. You can get them from the IS department or the health department. We don't have to move to the airport anywhere. We can stay in the human services building. Yeah, it might take, I'm willing to train with anyone to learn how to do it, but there have been successful meetings with Zoom to record them and use this device called an All Pro. And the reason why you use that is because you put it in the center of your meeting square, and whoever, what the camera will do, there are cameras all around this device, and it will pick up whoever's speaking will be on camera, and it has speakers to pick up people who are speaking. You have to be like 15 to 17 feet close. That can't be no farther than that, but they've been working. Everyone in the county, maybe you got one, Beth, I got one because I'm chairman of a committee, that how the procedure to do it. And I think we're not meeting next month, so we have time to learn how to do it. And we can, if we're gonna have Zoom meetings like this, it's no problem, because we have Zoom meetings recorded, you put on. If we're gonna have a hybrid meeting, like we did in the health board or PNF committee or at other committees, we learn how to use this Owl Pro, and we go about doing that. That's what I'm saying. And I think August is a good date. We could do it at our next meeting.
The owl works really well. Lots of schools are using it.
the only thing that I've heard about the owl is that if someone else sneezes, ruffles papers, it kind of, you know, it'll then turn it
No,
toward you.
no,
And
that's false.
I
That's
haven't
false.
seen that, but
okay,
maybe, but I have not seen that in meetings I've been in, but
okay.
You know,
Beth, you and I can talk later next month and we'll figure
I
out.
will also can I add that, yes, it's definitely available and there are people that know how to use it, but Mike, before you offer up health department or health department staff to be able to put on those services, just recognize that there is some learning curve and there is a capacity issue. So
I wasn't offering the health department
considering.
staff, hold on, I told IS department, I'm willing to train. And I was using the example, you've done it. So I think people can train how to do it. Like I say, every committee chairman and every department head got an email from Patty Francoeur saying, this is how you do it. I just think we have to learn how to
Awesome.
practice how to do it.
Yeah, great. I'm so glad that you guys are learning how to use it.
I understand I got a job assignment, so thank you, Mike.
And also, Mike, you may want to pursue that training, you know, between now and August, because that's what we might end up doing, is if we're going to have it here in this building hybrid, maybe you could help us run it. So you might want to
Okay.
look into that.
All right. So committee priorities for August.
Oh, yeah, just to be prepared. So that was brought up at the last meeting, but we already had an agenda for this meeting. So we're not going to talk about it today, but I also don't want you to start thinking about what you want for priorities when we get here in August. So in the next 2 months, if you can think about what you would like to see our committee's priorities be. I think Harold brought up some good points at the last meeting about we have a lot of interests and a lot of passion and a lot of things to advocate for. So what do we want to prioritize in terms of next steps and what action we want to take on things? So just to be prepared for it.
Okay. Alana, or do you have any updates on public health?
Not necessarily. Outside of Nicole and I have been able to bring a few staff, and we met with Brian's crew too. So a few of the tangible takeaways is we in the health department are working on our referral process to offer more online options so that there's consistency across your staff, our staff. But otherwise, definitely taking the referrals for both the older and the youngins again, and our staff are happy to be interacting again. Nicole and I presented at the Oshkosh Healthy Aging Committee on Tuesday morning, and they were happy to hear from us and connect a name with a face. So really getting back out there and picking up where we left off with our partners quite a while ago. So that's exciting.
As always, thank you.
And I don't know, I got on a little bit late. I was meeting with a staff member, but did you tell them about our open house, Beth?
Not yet.
Oh,
I'm leaving that
Good
for you.
segue for you.
Yes.
so we are going to be having an open house, and Rochelle, our intern who is on here, is really good at social media and making brochures. And so she made some really awesome flyers. So it's in August, on Tuesday, August 16th. We are going to do an open house. We're going to have a panel running, and we're still planning it. So we haven't teased everything out yet, but we're going to be giving everyone small presentations on everything that we do and our roles. The health department is going to team with us on this. And we are going to have a competition. Each team is going to be making a berry themed item, and it's a berry themed summer event, and everybody will be able to come and taste the things that we've made and vote to see whose is the best. It's a little bit of a fun competition, and we're going to have raffle prizes. The goal is just to try to make the ADRC and human services, public health, more open to the community, and to have people see that this isn't a scary place to come into, even though it looks like a government building, but that we are welcoming, we're fun, we're engaging, and we really just want to be able to reach as many people in the community as possible and tell them a little bit about what we do in a fun and open way. We're also trying to get our staff excited about it, because everybody loves to connect with the community, and we're trying to do it in a really just casual and chill way so that people can feel comfortable coming to us, and it's not, scary to reach out to us. So more on that, but we are very excited, and we have a planning committee, and we're gonna try to do it with no budget, and come on and come see us.
It's
When
going
is
to be
it now again?
It's going to be a very nice event.
Yes.
What's the date for it?
Cool.
What's the date for it, Nicole?
August 16th, Tuesday, August 16th.
So what happens if ADRC wins the competition? Can we take on public health by snowballs or something?
Well,
I'll
and
come
what
up with some food hazard that comes to my favor.
I
and
think
what time is the event,
they're
Nicole?
batting around a dunk tank, Paul, I think.
Oh,
Losers have to go in a dunk tank, so.
Yep.
Rochelle, do you want to throw out one of your flyers? Beth, can you share your
I'll give her
screen?
sharing. Yeah, I'll let her share here. And I have to give Rochelle credit too, because this caregiver study that we just went over, Rochelle actually did that for me. I kind of ran out of steam and didn't get to it, and she did that for me. Let's see here.
Okay, that was supposed to be clapping, not me raising my hand. I thought that was clapping. Sorry.
And also, while I'm getting her access to do this, I don't know if you guys saw all the comments that were in there. If you want to take a look at any comments in the chat, but let's see here. Here we go. Okay, you should be able to do it now.
Okay. Okay. Is it working? Okay. Oh, there you go. Okay. Oh, Nice.
So you can see that there's going to be presentations pretty much on the hour, and then in between presentations about what all we do here, people will have an opportunity to talk to staff, you know, ask to have a memory screen done, ask to have someone assist with power of attorney paperwork. And if you have specific things you want to talk about with any of our staff members, that'll be in between each of the presentations.
Looks very nice.
Thanks, Rochelle.
Okay, Nicole, anything else from your end?
Nope, I think that's it.
Brian?
Hello, we are staying busy over on our side of the house. Of course, I feel like a mina bird and I say the same thing every month,
Yeah.
but we are, it's interesting because Beth was talking earlier in the meeting about the fact that we're making more contacts per person that calls our ADRC, and our data actually for last month, and I suspect most months, proves what she was saying. We had, for the month of May, we had 1,454 charted contacts with people. That was 498 people that we had contacts with. So that says we're averaging 3 contacts per person. Now, there are certainly some that we have only 1 contact with, and there's some that we have 5. So we're averaging about 3-ish calls per customer at our ADRC. So 498 people we served in the month of May. Out of that, we did 116 long-term care functional screens. And from that, we did 50 enrollment packets to Family Care and Iris. And so that I've been reporting, and I love to get those numbers into the meeting notes here, just so we can kind of prove what the work is that we're doing here. I think it justifies the hard work that's being done, but 50 enrollment packets is up. It doesn't seem like a lot, but that's up from our usual. If you remember, I usually pack, it's usually around 45. So we are humming right along. And all that being said, we are have been down a staff member. We had, I think I reported last month, we had Sydney Winky going out on maternity leave. She's now off and has had her baby. And we now, starting today, have one of our retirees, Carla Stark, has actually agreed to do a limited term employment with us for the summer to fill out those days. So it's actually working out very well. But that just started today. So we're going to see the benefit of that in the next month or 2 here. So we're excited about that. And then also the other really cool thing that's happened to us is, and Colin is actually on our call today, Colin Falk has actually joined us as our MA assistant. She is that person who's responsible to be our liaison between our ADRC staff that are doing physical eligibility for Family Care and Iris, and our economic support people who are doing the financial eligibility calculations. So that has worked very well for our agency in the past. It's made communication way better. And we're looking forward to having Colin in that role. It's going to take a while. There's a lot of learning on both sides of the economic support as well as the ADRC that needs to get done. So we're not going to scare her off by giving her too much work right away. But we're excited. Great personality, fits well with our team, and just ecstatic. So we are definitely in a good place moving forward. And I think that's all I have. So thank you.
Thanks, Brian. Liz, anything for you? Harold?
No update.
Tamara? Okay. Mike? Kate?
After missing a few meetings, it's nice to be back.
Nice to have you back.
Good to see you again. Jan?
Nothing to report.
And Rob, sorry. Had a brain fart.
No update.
Okay. As an aside, I don't know whether I'll be at the August meeting or not. I'm visiting with our colleagues at UW hospitals for a potential knee replacement surgery next week. So I don't know when that'll be scheduled, and its impact on my ability situation, but you can talk about me when I'm gone. So
Best
I'm not-
wishes and prayers for a very
Yep.
happy outcome, whether it's surgery or whatever,
Yep.
but hopefully.
Yeah. So thank you. Beth, do you have any other closing thoughts?
Yeah, I did have a couple other things that came to mind. One of them is if you know of anyone who has a scooter, wheelchair, anything like that, that they want to have cleaned, we have a free event in Oshkosh on it would be the 25th. So a week from this Saturday. It's at J&R Auto on North Main in Oshkosh, 525 North Main, which is about a half a block north of the farmer's market. It's from 10 until 2. You can look on our website and find out more information, but there's free food, music. It's a great event. So if you know of anyone who needs their wheelchair spiffied up, excuse me, send them on over. Also, just as an FYI, because these meetings and the recordings of them are going to be posted on the county's website, the notes are going to be very sketchy. So it'll be pretty much just what the topic was, whether there was a vote on it. There won't be the in-depth notes anymore because there's no point in having someone basically transcribe everything that's available for you to either view or listen to. So the notes will be very minimal from here on in.
Beth, just so you know, I'm going to go out and visit Pete at the medical equipment locker a week from this Friday to pick up sufficient chairs to accommodate the folks on that for the wheelchair wash.
Thank you.
So we're going to see Harold and Brian on the 25th? Right, Harold?
Yeah, I'm gonna be there, yes.
All right. Brian, you too?
Oh, sure.
Okay.
Do you need more help for that?
Okay, we have
More
quite
than
a
merry.
few people who've come forward. Anyone's welcome to stop by, but the more the merrier. But, sometimes people arrange their day to be there to help. And then if you're really not needed, it's kind of inconvenient. But I think we're doing okay with help.
Okay.
Mike's going to be doing most of the work.
With a lot of supervision from a number of us. Excuse me. Any other business before the committee? Otherwise, I think we can consider ourselves adjourned.
Mike, if you're able to give me a call about something right after this, I'll play Paul in as a follow-up for something coming up.
But
All
nice
right.
summer, everybody.
You
Thank
too.
you.
See you in
Good luck,
August. Have a great
everyone.
week.
Bye-bye.
Thank
Appreciate
you.
your time.
Thank you.
Bye-bye.